Hi everyone, welcome to today's video. I'm Mary Felling, physical therapist. Today I'm going to be showing you a pelvic floor release. This is great for anybody with low back pain, hip pain, sciatica. This is also really good to help open up the area back near the sacrum, so it's also good for any of you dealing with sacral pain. When you're doing this position, you can be on the couch, you can be on a mat, you can be on your bed. It won't affect the outcome, and you'll still get a good outcome. I will say for any of you who have any kind of groin pain, get a couple of small towels or washcloths. So I've got some hand towel sized cloths here. Roll them up and keep them with you because I'm going to show you a modification real quick in case you do get a little bit painful there in the hips or rather in your groin. So keep those nearby. If you're someone who's dealing with painful shoulders or you have very tight hips, there is a modified position for this technique that I'll show you. We're going to get started in a minute. Make sure that whatever surface you're lying on is soft because you will have a lot of pressure back to that lower tailbone area, the sacrum and the tailbone, so you don't want to get that bruised. All right, let's get started. So I'm going to be working up here on my treatment table. You guys get on whatever surface you're going to be using. You can use a pillow. You don't have to. It's just for comfort. It won't affect your technique that you're doing. So you're going to lie on your back, knees are bent. I'm going to give myself a little more comfort under my neck. And I'll put these in later. So here's the position. You're going to bring your legs up one at a time. And your knees are going to kind of come out to the sides, kind of what I call a frog leg position. Your hands are going to get placed on the instep, so not up at your toes, not down at your heels, the instep of each foot. And in this position, you gently, gently, gently give ounces of pressure that will cause the knees to come towards the table or towards the floor, whatever surface you're lying on. And as you do that, you will feel this beautiful, nice elongation through your pelvic floor. Don't overdo this. I'm not pushing as far as I can and holding. I'm just giving ounces of pressure, enough for me to feel this stretch. I feel it deep kind of on the insides of my thighs right now. But in a few minutes, that will get even stronger. Here's that modification I'm talking about. So you can see I'm right next to a wall. So you're going to be right up next to an open wall space. You can be on the floor if you want, but just remember, put something underneath your low back and your tailbone, your sacrum, because you'll be there a while and you don't want to bruise that area. All right, so you're going to lie on your back and you're going to put your feet up on the wall. And you want to get your rear end as close to the wall as possible. So you kind of have to shrug yourself down towards it. And then, and again, your knees are going to frog out. You want to kind of keep your feet just so that the sides of the feet, so I'm not like this, I'm like this. You'll feel that difference, how just changing that angle increases the stretch here. If you are painful in your groin just in this position, go ahead and put your two towels there in each side or one side, whatever you need. I don't really feel it here, so I don't need it. And then in this position, just like gravity, kind of gently bring your knees down. And then if you can see, my elbows are on very close to the front of my thighs. And I'm just going to put my hands here and gently give a little stretch out. So that helps to bring the knees closer to the floor. But I'm not doing any work in my body to keep my feet up. The wall is doing all the work for me. And then from here, you would continue that 5 minutes. And here's a bonus modification. So you're going to be lying back down again on your back. For those of you who need the rolled towel in the groin, have that ready. You can just do one leg at a time. You don't have to do both. You'll still get the results, and you'll feel it in your groin. Kind of move it around. And again, the most important thing is that that leg is frogged out. It's not coming into your chest. The knee is bending away from your body. And then you can do one at a time. Just hold there, just adding that little few ounces of pressure in the instep to increase the stretch across the pelvic floor. Get that nice pelvic floor tissue starting to open and release from the fascial restrictions. And then when you're done with one leg, after 5 minutes or 6 or 7 or 8, however long you'd like to stay there, minimum of 5 though, remember to go and do your opposite leg then. Okay, we're going to start the timer. This is 5 minutes. We're doing the John Barnes Myofascial Release technique. Now, for you yogis out there, you probably recognize this as the happy baby position, the happy baby pose. But what makes this a myofascial release technique is because we're pressing in and giving some elongation, a sustained elongation through the hips, the groin, the pelvic floor. And we're doing it for a minimum of 5 minutes. I will do 5 minutes today because it takes 5 minutes to address the fascial system. Anything less than that will not address the fascia, just addresses the muscular component. So in this position, there's a mechanical energy we're using right now. It's called elongation, and it's getting elongated down in our groin and our hip and our pelvic floor by just helping the knees to come a little closer towards the ground or whatever surface you're lying on. And that's maintained. I'm not letting back up. I'm not pushing harder. It's almost like you press enough where you feel you've taken all the slack out of your groin, the insides of your legs, the pelvic floor. You don't push past that. You don't push past the slack. You just take it to the end and you hold. And that's what starts this. After 5 minutes, it elicits the piezoelectric effect. The piezoelectric effect refers to a bioelectric flow in our system, which moves along the fascia. The fascia is like the copper wire in our body. And as it moves along the copper wire, the fascia, when it comes to areas where the fascia has been bound down, tightened, dehydrated, it helps it to rehydrate, elongate, and soften. And then you feel that as, oh, I think I can go a little further. I feel my knees are dropping a little bit further towards the mat. Or you might feel, oh, I feel like butter melting or taffy pulling. Or you may have less pain. Any of those are considered a release. Releases start about 5 minutes in the fascia. So if you're feeling something like that before the 5 minutes, it's the muscle that's opening up and softening, which is good. You want that too. But we're really looking to affect the fascia, and we want that because the fascia has been what's overlooked for so many years when it comes to chronic pain and dysfunction. It was not really considered part of the picture of what creates chronic pain, and now we know that overuse, repetitive use, stress, just being a human being alive on this planet, all of those things, along with surgeries, poor postures over a long period of time. How many of us are at our desk for a long time every day, right? And all of those are considered injurious to the fascia. And so when you have repetitive overuse, repetitive positioning, prolonged sitting, things like that, it causes the fascia to bind down. It can create enough tension that it could put up to 2,000 pounds of force per square inch. While this fascia is like a cobweb in our body, it surrounds, it supports, and infuses everything. So our muscles, our ligaments, tendons, nerves, blood vessels, organs, everything has this cobweb of fascia through it and around it. And so when it is in overuse and develops these tight areas, it can pull through other areas of the body. So the fascia that's down here, don't let go of your hand, I'm just demonstrating. All the fascia through here is a different length of the same fascia that's woven through the rest of my body. All right, so for some of you, if you have groin pain, if you're feeling really tender in here, you can take those towels I talked about earlier. You might only need a washcloth, but you can use a hand towel. Put it right deep in your groin, take the other one. If it's both sides, if it's one side, you only need it. And then use that kind of like a cushion. Does that make sense? You don't have to do it on both sides. You can do it on one. So remember, minimum of 5 minutes. Feel free to do this for 7-8 minutes, especially if you're feeling some release. You may feel this down the back of your hips. You might be feeling this through the side of your hips, up in the front of the thigh, the area of the quads, on the back of the thigh called the hamstrings. It's good. You're just getting a nice release through the whole hip trunk area. All right, so we're coming up to the end of those 5 minutes. And like I said, feel free to continue on to get more and more releases. I'm going to stop here just for our schedule for today. And in that position, if you're going to continue to 7 or 8 minutes, that's great. And then tomorrow and for another 12 days, so a total of 14 days, you want to continue doing this technique so that you continue to open up that cobweb, the fascial system where it's been bound down and tightened through the groin and the hips. There's very few people over the age of 40 who've gotten away without some kind of myofascial restriction through the pelvic floor, abdominal, hip, lower trunk area, low back area. This is really great for start opening everything, getting some motion back in your hip, and reducing pain in the low back, the sacrum. You will love this. Do it for 14 days in a row though, so you get the full benefit. And then after that, just 2 or 3 times a week to maintain that positive change you got. All right, thank you so much for showing up today. I encourage you to subscribe to my channel so that every time a new video comes out, you're made aware and you can continue taking good care of your body to maintain that healthy, pain-free lifestyle. Thank you for showing up today for yourselves, making your lives better, and I'll see you in the next video.